Hello! Today we are going to learn how to extract a third molar in the simplest way possible. The third molar, commonly known as the wisdom tooth, is located at the very end of the mouth. In many cases, it does not fully erupt or grows at an incorrect angle, causing pain, infection, and other complications. Accurate diagnosis of the third molar's position is crucial. OPG, RVG, and CBCT scans are used to examine the exact location, angulation, and nearby structures of the tooth. Step-by-step surgical procedure. 1. First, the patient is given local anesthesia. 2. A small incision is made in the gums, and a slight portion of the bone is removed. 3. The tooth is carefully sectioned and extracted to minimize stress on the jaw. Finally, sutures are placed, and the necessary post-operative care is provided. Now, let's understand how to take proper care after wisdom tooth extraction. If you have recently undergone a wisdom tooth removal, it is essential to follow proper post-operative care to ensure safe and quick healing. Let's go through the key steps of post-extraction care. First 24 hours. After the extraction, a gauze pad is placed in the mouth. Keep the gauze pressed gently for 30 to 45 minutes. If there is excessive bleeding, replace it with a clean gauze and apply light pressure. Avoid hot foods during this period and apply a cold compress to reduce swelling. Eating and drinking. For the first 24 to 48 hours, consume only soft foods such as yogurt, soup, cold milk, juice, or porridge. Avoid hot, spicy, or heavily seasoned foods. Do not use a straw, as the suction can dislodge the blood clot, increasing the risk of dry socket. Oral hygiene. Do not rinse your mouth during the first 24 hours. After that, rinse gently with warm salt water. Be careful while brushing near the extraction site. Do not apply too much pressure. Pain and swelling. Some pain and swelling after extraction are normal. Take the prescribed painkillers on time as instructed by your dentist. Apply an ice pack on your cheek for 10 to 15 minutes every 1 to 2 hours to reduce swelling. Things to avoid. Do not spit forcefully or rinse aggressively. Avoid smoking or tobacco consumption as it delays healing. Do not chew hard foods or let food particles get stuck in the extraction site. When to visit the dentist? If you experience severe pain, excessive swelling, continuous bleeding, or fever, contact your dentist immediately. With proper care, the discomfort after wisdom tooth extraction can be easily managed and healing happens faster. If you found this information useful, like and share this video, and subscribe to our channel for more dental health tips. Wisdom tooth extraction is a safe and simple procedure, but it should be done at the right time. Consult your dentist and take the right steps toward a healthy smile.